Okay, so good afternoon, good evening, everyone, depending on where you are. I am Olutayo Adeyemi, an associate lecturer at the University of Ibadan in Nigeria. And I'm going to be making the presentation, talking today about the data methods on food security and nutrition, along with two colleagues who are online, Ruth and Emily. And I'll just hand over to them to introduce themselves and get the session started. Thank you.
Hi, everyone. Good evening. I'm Rose Verstraat, and I'm with the European Commission's Joint Research Centre in Italy, and I'll be talking a bit about an evidence synthesis that we did on food security and nutrition linkages, after which then Emily will come in. So Emily, if you feel free to introduce yourself.
Sure. Hi, I'm Emily Bobrow. I'm based at the Johns Hopkins Bloomberg School of Public Health in the US. And yeah, as Rose mentioned, I'm going to be one of the presenters, and I'm going to be talking about core competencies that are needed to work with food security and nutrition data.
Okay, then I guess we can get started with sharing the slides. Thank you. Let me just, okay. So thanks for joining the session, and I just want to give a brief overview on where we are at with food security and malnutrition. So with 7 years remaining to achieve the SDG 2, we kind of see that global statistics for hunger, food insecurity, and malnutrition are trending in the wrong direction. So existing policy actions are proving insufficient in the face of pandemic, conflict, climate extremes, and economic shocks. And actually, the 2022 Global Nutrition Report called for greater attention for both food security and nutrition security commitments. So next, you'll see that to facilitate this, we need a better understanding of linkages between food insecurity and all forms of malnutrition, which in turn, in the next step, you'll see requires investment in data and measurement and innovative methods. So like I said, in the next slide, you'll see that this has led to an ongoing research work that aims to better understand linkages between food insecurity and multiple forms of malnutrition. And within that, we did an evidence synthesis for which I'll present preliminary results today. But before we get into this, I'd like to ask a few questions using the Mentimeter. So here is, if you're happy to go to the website of the menti.com, you'll have the code as well as the QR code to access those. So I just want to quickly ask two questions. The first one is, have you assessed associations between nutrition outcomes and food insecurity before? So we should have the Mentimeter coming up, and feel free to just to get an idea of how many of you have actually assessed or looked at this previously. Okay, interesting. So we've got one person that's a yes. Happy to hear from you during the discussion later on, but also those that haven't yet. It would be great to get some input from you later on during the interactive discussion. If I may ask the person who has, three in the meantime, great. The next question was, if you have used it, which food security metric or measure did you use? So that's the next one. Okay, so FIAS, food access, and HFIAS. Okay, great. Thanks. We'll come back to this during the discussion. Tayo will lead on that. But it gives me a bit of an idea of how detailed I should go in my presentation now. So to better understand these linkages, we actually conducted a rapid systematic review to synthesize the available evidence. And this work will in the end result in a systematic map highlighting where evidence exists as well as where there are gaps. And in the next step, we then also aim to quantify the associations through a meta-analysis for pre-specified food security metrics, as well as with all forms of malnutrition. Just to clarify that we only included peer-reviewed research, and this at the level of the systematic map. We did not assess quality appraisal, but we did plan for that on the meta map. So in this slide, what you can see is our overview of the food security metrics that we included. This is a bit of a large set because considering the different definitions of food security and how they have evolved over time, we thought it was important to include experience-based, as well as dietary diversity indicators, as well as coping strategies. And for malnutrition, we also thought it was important to go beyond any associations with under 5 or child stunting, wasting, or underweight, but also include other forms of malnutrition across different populations. So any study that looked at an association between at least one or more of these exposure measures or outcome measures were included in our mapping. Now, in the next slide, what you see here, I know it's not readable, it's not intending to be. Just want to show you the work that we did to try and capture the complexity of these different food security metrics. We actually compiled for each metric an overview, including their purpose, the target population, food security domains they measure, what it was validated for, the recall period, the score, etc. So this is what we used throughout our work. In the next slide, you can then see the question framework. So that's what we applied to our mapping review. And the reason I put this up is because I wanted to highlight here that we included any population in LMICs, including both over and under nutrition outcomes, as well as micronutrient deficiencies and low birth weight. And we also mapped out any other diet-related outcomes that were modeled for the included studies. We screened about 9,308 papers across 2 electronic databases for peer-reviewed studies, like I mentioned, and then in the end included 206 references in our analysis. So in the next slide, you'll see that for each of these studies, we coded for both general characteristics as well as specific characteristics. And some general ones include the country the study was performed in, the graphic scope, the seasonality or any time indication of data collection, objectives, obviously, and so on. For specific characteristics, we coded all these included studies for the type of food security metric that was used, as well as the different forms of malnutrition, and then the covariates that were assessed in the included studies to understand which pathways were modeled, and any other nutrition-related outcomes, like I mentioned. So in the next slide, what you'll see is our analytical framework. So for our data synthesis, we used this applied version of the SOFI framework, which was the best match considering we were focusing on a direct pathway between food security and different types of malnutrition. So to provide an overview of which domains or elements were captured by the included food security metrics, we actually mapped these out onto this analytical framework. And obviously to which of the domains that they were aiming to measure. In a few slides, I'll show you the results, but for capturing the covariates of the pathways between food security and malnutrition, we also used the UNICEF framework to categorize these, and then we'll visualize these on the analytical framework, which we'll show you in a bit. So I will share some preliminary results of our mapping. So we're currently finalizing analysis, but we included a total of 206 references, including 193 studies that were conducted in 41 different low and middle income countries. So what you can see here on the left-hand side image is that countries with the most frequent assessments of these relationships were Ethiopia, Brazil, Iran, India, Nepal, Bangladesh, Malaysia. So, and among these countries, I think what's important included in the review is that we looked at how many were classified as food crisis countries at least once since 2020. There were only 15 out of the other whole set of countries, so 24 have never experienced food crisis and were not included in here. So the highest number or the primary outcomes of interest were stunting, underweight, or wasting, as you can see on the right-hand side in the table, as well as overweight in any population. So clearly less frequent studies, studied outcomes included micronutrient deficiencies, double burden of malnutrition, and low birth weight. Also, I think important to mention here is that most publications examine either 1, 2, or 3 outcomes, and we've got about 26 references examining 4 or more, and the most commonly assessed combinations for outcomes were obviously wasting, stunting, and underweight. So what we saw in our mapping is that to measure food security, the HFIAS, so the Household Food Insecurity Access Scale, has been most commonly used across 94 studies and was closely followed by the USDA Food Security Survey module or any adaptations of this, like the Brazilian Food Insecurity Scale or South American countries using the ALXA or the Mexican or Colombian Food Insecurity Scale. What you can see here is that the studies that actually assessed food security and malnutrition indicators in children under 5, like stunting, wasting, and underweight, they mostly use HFIAS to determine food security. And for overweight or obesity, it was mainly the USDA food security metric or an adaptation. What I think is also important to highlight here is that, 15 references reported using multiple scales of food security, with the most common combinations being HFIAS with household dietary diversity score or food consumption score. What we also note is that variations were observed in the number of questions asked in these metrics, or when the metrics were applied, and the recall periods applied in these scales, very often deviating from the standard and validated approach. Next, please. So when we look at the associations found between food security and malnutrition, we see that most of the studies identified an association between stunting or underweight and food insecurity. And these mostly, again, used HFIAS and again were followed by the USDA scale, as you can see here. In the next figure, what you see here is an overview of the number of studies that found positive association. So the blue is where we've got, so you see the total number of studies, and the blue is where out of all of these studies included that measure this outcome where there was a positive association. So what we clearly see is that it's very largely related with stunting, but also a large coverage for wasting and stunted children when measured, when co-occurring, the double burden as well as low birth weight, even though the number of studies were much, much lower. We also see that there is an association with wasting and overweight, but much less apparent than in the other malnutrition outcome cases. So in the next slide, what you see here is the analytical framework, like I mentioned. So you saw this image before. What you do see here now is actually the visualization of the number of studies and which covariates they included. So as I mentioned earlier, these have been categorized using the UNICEF Framework, and most publications actually have reported on including social demographic variables in their models, like age or sex, or income or wealth. And then maternal education or employment was also included, health status, breastfeeding, or IYCF practices. Much less so were food access through markets or own production, physical activity, nutrition knowledge, or information access, for example. The large majority reported on more than 3 of these categories, and what we also included were covariates related to depression and physical activity, or mental and physical well-being. But this was only included by very few studies. And also important to mention is that about 20 studies did not consider or even report the covariates that they included in their model. And most of the studies that then identified an association between food insecurity and undernutrition They included covariates related to household demographics or socioeconomic status. And to a lesser extent, they assessed, sorry for that, they assessed women's employment or education, or WASH or practices. So in the next slide, what is this now? What does this now mean? We still have to finalize our synthesis, and in the next step, what we aim to do is use the HFIAS and HDDS and do a meta-analysis versus each of these nutritional outcomes. Obviously, we will also do a quality assessment at that stage. I'm so sorry. But what is very clearly with this, having performed the studies, is that context and seasonality needs to be better described, as well as the food security metrics and how they have been applied. But I'll now hand gladly over to to Emily for the next steps, and Taya will come back to that when we have our discussion. Thank you very much.
Thanks, Rose. So I'm going to talk a little bit about the knowledge and skills, what we call the core competencies that are needed to effectively use data on food security and nutrition. Sorry. And so my objectives are to sort of define concepts, core competencies, and data literacy, because those are what I'm going to focus on. Try to make the case for why developing core competencies on food and nutrition data literacy is important and additive to what we already have in terms of core competencies. And then sort of share with you our process for developing these core competencies on food and nutrition data literacy, and ask you as an individual and a representative of your organization to help us with this work and contribute to it. So I'll explain some different ways you can do that. In terms of definitions, core competencies are the combination of knowledge and skills that are required to successfully do your job or do an activity. You can develop core competencies on different levels. What we're focused on here is the individual level, and focused on technical skills for nutrition data literacy. And this is in the effort to help countries and have some global standards on the composition of a National Nutrition Information System team, an NNIS team, and help with all the work that's being done on capacity strengthening in those teams and with those individuals. The other important term here is data literacy, which reflects an individual's ability to read, understand, and utilize data in different ways. So this is what we talk about in terms of data for decision making. Really being data literate is an important factor here, and we know that this is one of the barriers to having data informed decision making. And the idea is to promote and use the data for nutrition policies and to help identify these data literacy skills for stakeholders in an NNIS. Why do we need this? Well, nutrition is complicated, right? It's across sectors. Malnutrition is multifactored. Data sources come from so many different places, from surveys that are periodic, from administrative data that is more routine. We know from Rose talking about all the different indicators for food security in particular that those are scales that are very complex, and that these linkages between food security data and nutrition outcome data are kind of unclear. And so we feel that that's really important in terms of having these core competencies defined to inform position descriptions, to design assessment tools, and through those assessment tools also provide training curriculum that are focused on these core competencies. And we have, our nutrition data value chain, which originally when it was created, if you look back at the original documentation, it was a linear system. And that was updated pretty quickly because we know that decision making is sort of the beginning and end and part of the cycle that continues for the value chain. And we also, in terms of the project that I work on called Data Dent, that's based at Hopkins with a number of partners, we know that there are additional sort of underlying factors here in terms of strategic leadership, capacity strengthening, and finance that are really important to support the nutrition data value chain in all aspects of it. And these core competencies are really important for these core pieces of the value chain, the decision making and the capacity strengthening. We also have guidance documents. I keep mentioning the National Nutrition Information System teams. This guidance document from UNICEF and WHO is, has data as one of the 5 main factors that need to be supported and are important for these teams to work. So in terms of core competencies and what's already available, many of us have worked as M&E officers or information system specialists, those kinds of positions. And so those core competencies we know are well defined. A lot of us have backgrounds and training in public health nutrition. And again, those competencies are often well defined. What I'm talking about here is additional competencies that are specific to nutrition data and nutrition and to food security data, and that these competencies are where the gap is. Just defining those knowledge and skills specific to food security and nutrition data. And this is what I'm calling nutrition data literacy. Again, saying that this is additive and that it would support individuals in the NNIS teams. The way that we're conceptualizing this is that the competencies would be along the data value chain and also would be linked to the UNICEF framework. And this is the process that we've proposed. And we've done some of the beginning pieces here, specifying the scope and the audience, engaging with stakeholders. Part of that is me sort of talking to you all about this area and reaching out to organizations as well, reviewing existing competency documents, and also engaging here now with more sort of global partners as well as in-country partners, and validating sort of draft core competencies that that we will develop in concert with organizations. And then once we validate those core competencies, then develop outputs. And this could be a document that talks about the core competencies and this process to get there. Also develop a capacity assessment tool, sample job descriptions, and capacity strengthening curricula. So this is where we're at. This is the process that we're working on to develop these competencies. And DataDent has a vision here and a commitment to using a human-centered design approach. So on the previous slide, I talked about specifying the scope and the audience. Some of that would be to use a human-centered design approach and create personas, which are sort of fictionalized compilations of profiles of different data users, data actors. And to think about these in terms of based on data, but based on the data and creating these kind of profiles. So this is just an example of one that we have come up with as an idea, but we're also collecting more data about data actors through our work in countries in Nigeria, Ethiopia, and India, and then also through a community of practice called Data for Nutrition, and I'll show you more about that in my later slides. So just to give you an example of what this might look like, it's core competencies. These are some examples of those on using food and security data, sort of hoping that somebody working in this area would have the ability to characterize the dimensions of food security and apply appropriate metrics, have the ability to analyze relevant food security data and interpret the scientific evidence to develop and implement plans for food security to address food insecurity, and the ability to interpret the dimensions, the types, and the severity of food insecurity. So these might be just some specific ones for food security data use. So just wrapping up, in terms of engaging all of you, as I mentioned, we're working with stakeholders and partners, and DataDent is looking for advocates and people to connect with. And I put my email address there if anyone wants to reach out and represent your organization and work on this with us. But you can also do this on an individual level. I mentioned that there is a Data for Nutrition community of practice. And if you haven't already, please do sign up for that. It's a group of more than 1,000 people working in the field of nutrition data, and is sort of an exciting place and way to interact. And we'll definitely be engaging with individuals through that platform on this core competency work. All right, so I'm gonna go back to the poll. If everybody can go back to the Menti poll, and this one is hopefully gonna be a cloud networking around data. This is great. Understandable code. Great, thank you. This is great. Data cleaning management. I see data cleaning a couple times. Yeah, very helpful. Thank you so much. I think these are the kinds of things that we would definitely want to include in core competencies that we create. So I definitely encourage all of you to either reach out to me if you're interested in being part of this work, or know somebody who would, or an organization we should make sure we reach out to. And then definitely please sign up for the Data for Nutrition community of practice. And the website is just Data for Nutrition. If you search from that, you'll find it. All right, so I'm gonna stop sharing this. Yeah, you can keep adding. This is great. Thank you. This is helpful for us, but I'm gonna go back to the slides and hand it over to Taya.
Thank you very much, Emily and Ruth. So I'll just synthesize the work that we are doing. So taking from both Ruth's presentation and Emily's presentation. Next slide, please. And so if you look in the literature, there have been quite a number of studies looking at food security and the different food security matrices. So we have the one in 2013 by Jones et al. That actually asked, what are we assessing when we measure food security? And they looked at different indicators for food security and what they measure. And other authors have also looked at what the indicators have been validated to measure. Next slide, please. And the thing with food security is that it has several dimensions. There's availability, there's access, there's stability, and there's utilization. And we have different indicators. So food security itself is sort of like a hidden constructs. There's food security with all of these dimensions, but then we have indicators, and most of the indicators, there's no food security indicator that measures all the dimensions of food security. They all measure parts of it. And then for malnutrition is also just not one thing. There's undernutrition, there's overnutrition, there's micronutrient deficiencies, and then in undernutrition, there's stunting, there's wasting, there's underweight. And so trying to understand the linkages between food security and malnutrition is challenging for this very fact that we have different dimensions of food security, different indicators measuring some but not all dimensions, and then all these different nutrition outcomes. And so we are seeing more that some indicators of food security may be stronger, there may be stronger linkages between some indicators and the forms of malnutrition based on the dimensions that are measured by the different indicators. And so we are trying to understand these linkages better. But then the indicators also have been validated for specific things. And the research articles we are saying, they are not always used. So the researchers don't always use food security for the purpose for which it has been validated. So if you take the example of an indicator like the Household Dietary Diversity Score, it's a commonly used food security indicator. It's used to track populations at risk of food insecurity, both for the IPC, the Integrated Phase Classification, as well as the CAD harmonise, and it's being regularly collected. And then you've seen some authors who have tried to link the Household Dietary Diversity Score with a nutrition outcome like micronutrient deficiency, like deficiency of anemia or vitamin A. But the Household Dietary Diversity Score was not validated as a measure of likely micronutrient adequacy of diet at, for members of the household. It's been validated for food access, whether or not households have access to sufficient amounts of foods. And so we see some of this where people are using food security indicators for purposes other than that which they were validated for. And so it's very important that if we are going to measure food security, that we need to make sure that the indicator of food security we use is right for whatever the purpose we are assessing food security. Next slide. And so this goes back to the framework that Ruth showed you. So when you look at food security, you can talk about the limited physical availability of food. So food insecurity now. So it can be limited physical unavailability of food. It can be limited stability of food or seasonal food availability. And then you can also, that is linked to the household access to food. So if there's limited physical availability of food, then the chances are high that there's also limited physical access to food by households, or limited access to markets that sell specific foods or food groups. And then you can also have limited household socioeconomic access to food, where the food is available, but households do not have the economic means to procure food. And then all of this leads to either one or more outcomes where there's limited amounts of food in the household. You can have limited diversity or safety of food in the household. You can also have households resorting to foods that are not culturally preferred, but that's what is available to them physically or economically. And then you can have a situation whereby the household even has access to food, but there's anxiety, stress, and depression over the possibility that they are going to run out of food, or there's going to be a time when they don't have sufficient access to food. All of that is included in what food security is. Now you'll see in the red, what is written in red are the various indicators and the factors that are considered by these various indicators. So if we take an indicator like the food expenditure share out of total expenditure share, that indicator considers the household socioeconomic access to food alone. That's the dimension of food security that is included in that indicator. But then you have indicators like the HFIAS that considers the amount of food in the household. It considers the diversity of food. It considers whether or not the food available to the house is preferred. And then it also considers whether the household has had to worry about their access to food. So you have those experience-based indicators mostly that consider various dimensions in the calculation of those indicators. I'll also say at this point that there's really no indicator as such that considers the safety of food in the measure of food security. They may consider diversity, but not necessarily the food safety, explicitly considering food safety. The other thing is that we know that food security can be acute, that's short term, and we know that it can be chronic. And right now, we don't have indicators to differentiate very well. If you see a household that is experiencing food security, the indicators we have are not very sensitive to say whether the food security is acute, so it's short term, or it is chronic. For you to be able to answer that question, you have to measure multiple things to be able to determine whether it's acute or chronic. There's not one indicator you can use. And then you'll see that all that box, the food insecurity, then leads to inadequate individual consumption of food within the household. And this can also be modified by the intra-household food distribution. So if you have a case in which the household is food insecure, but they decide that, oh, we are going to make sure that the young children get everything they need, and then it's the adults who will suffer, then you may have a situation where the household is food insecure, but the young children have adequate nutrient intakes. And so then from the intake, then that can lead to either insufficient amount of protein and micronutrients and calories, or it can lead to the intake of calorie dense but nutrient poor foods. So food insecurity can lead to either the undernutrition, stunting, wasting. It can lead to micronutrient deficiencies, but it can also lead to overweight, obesity, when people eat calorie dense but nutrient poor foods because they are not sure where their next meal is going to come from. So they want to eat as much energy as possible. Next slide, please. And so what is the value of the work we are doing? So I showed you already some of the literatures where other authors had asked previously, what are we assessing when we measure food security? So what our work right now is adding is, how is what we measure linked to malnutrition? We know that in the conceptual framework of malnutrition, we say food security is linked to malnutrition. But how can we empirically measure food security that is linked to malnutrition? If we wanted to track food security, to say we need to know early who is going to be at risk of malnutrition, which indicators should we be tracking? And so we wanted to understand those linkages better. And then if we say the various indicators are linked to malnutrition, which indicator first for food security, and then which form of malnutrition is it linked to? So for something like the IPC and other assessments to track food insecurity, wasting is a very big nutrition outcome that is being tracked because it's a risk of death. It shows severe food shortages and all of that. But we are increasingly realizing that some of the common food security indicators that we measure are not actually linked to, so you cannot, if the studies that have looked at association between them and wasting, they've not always found that link between the food security indicator and wasting. So the other thing that comes up is under what conditions. So Ruth mentioned how various studies have looked at covariates. We know that food is not the only thing that causes malnutrition. So are there some conditions where it is more likely that a food insecure household will become malnourished, either undernutrition or overweight, obesity? So we're trying to understand that better based on what is already available in the public domain. And then we are also looking at the knowledge and skill sets necessary to adequately measure both food security and nutrition. And the reason to do this is because we need the food security sector and the nutrition sector to talk more to each other. So it's not unusual you find nutrition surveys that do not collect any data about food security. And so we have nutrition, but we are not able to link it to food security because no indicators were collected. On the other hand, you also have food security surveys that do not collect any nutrition indicator. And so currently we are missing a lot of opportunities to better understand how these two problems are linked, so that we can develop better solutions to addressing both food insecurity and malnutrition. Next slide, please. And so this slide again just shows you the various covariates that people have assessed, sort of the conditions. So how does physical activity link with the dietary intake to lead to overweight, obesity, or how do childcare practices link with and with food security at household level to lead to poor child nutrient intakes and then child malnutrition? And then also the issue of depression, how depression is linked to whether or not people become anxious or worried about their access to food. And so there are all of these covariates, like Ruth mentioned. Some studies did not even assess any covariates at all, but our study is going to be looking more to see whether there are some particular covariates that we need to be paying more attention to. So I think we are almost out of time. Okay, so the preliminary conclusions from the work we have been doing is that if you are going to measure food security, first of all, you need more than one indicator, which is what is done for the IPC and other ways to assess populations at risk of food insecurity. But apart from selecting indicators, you have to be sure that the indicators you're using have been validated for the purpose for which you're assessing food security. The other thing we realize is that we need more data sets that measure both food insecurity and malnutrition. So there are still quite a number of gaps. For instance, the food insecurity experience scale, the FIES, is the SDG 2 indicator. But because the FIES is relatively new, there are very few indicators, there are very few studies. We found very few studies that have looked at the linkages between the FIES and malnutrition. Then we have organizations like WFP taking several food security indicators that measure different dimensions of food security and coming up with one indicator. So the consolidated, the consolidated rules, I can't remember what carry starts for right now. It's just gone out of my head, but it's a consolidated indicator that takes 4 different indicators and combines it to give you one indicator of food security, right? So it addresses some of the problems we've seen, that you are measuring different things to get at one thing. But the issue with the carry is that it's yet to be validated to say that, yes, this is a true measure of food security. And when you say that it measures mild, moderate, severe food security, that is exactly what it measures. So there are still gaps. So we still need more data sets. We need more work on understanding the linkages between food security and nutrition, and coming up with indicators that are fit for different purposes. And so I'll hand over to Ruth and Emily to give their final thoughts. Thank you.
Thanks, Chayo. No, I won't add any thought. I mean, it's late. You guys have been in the conference for 5 days, well, almost 5, sorry, 4. I have been 2 online. You see what it does, it messes you up. So thank you very much for being here. Please do reach out to any and all of us. With that, I'd like to thank you for still being with us at this time of the day, and hope you enjoy the rest of the conference, as well as online. Thank you very much for being here.